Hello everyone, Dr. James Stirrett here. Welcome to the channel. Today we are going to be talking about what happens when you are on a GLP-1 medication like semaglutide or Ozempic and you are not losing weight. Today we're going to be doing a deep dive on what I do as a functional medicine doctor, as a naturopathic physician. We're going to dive into the labs. I'm going to show you what I'm looking for in terms of hormones, nutrient levels, and metabolism, how we spark these things so you can get the most out of your weight loss medication. Let's jump in. So many patients come to me now, they're already on a GLP-1 medication like Ozempic or semaglutide, and they're just feeling stuck. They felt like, the system is failing them. Maybe they got this prescribed, or they got this prescribed through an online doctor. They weren't really told what to do as from a diet or lifestyle perspective. There was no tailoring to them whatsoever. They were just stuck on a generic dosage, and they're not losing weight. Or maybe they started losing weight initially and they're stuck. If you're in that position, then this video is for you. We're actually going to jump in and take a look at a client of mine. Her name is Bobby B. And Bobby B is a middle-aged female. We'll pull up her labs in just a moment. You'll see that we've run functional labs on Bobby. What this means is she fell into this position where it's like, man, semaglutide's not working. We want to look deeper. What's going on? We want to look deeper than just the cholesterol, the standard panel that your doctor would run once a year. So we run functional labs. What's happening with her hormones overall? What's happening with inflammation? Vitamin markers, thyroid, the whole enchilada. So let's dive in and check out Bobby's labs. And from there, I'll be able to show you exactly how I treated Bobby and was able to help her get off the 30 pounds, which was her ultimate goal. Hey guys, okay, so here we are with Bobby D. Now she's a 48-year-old female when I first met her. Perimenopause, she'd been in perimenopause for a couple of years, really struggling with just night sweats, poor sleep, insomnia, really those classic vasomotor symptoms that we see in women struggling with perimenopause. She was also struggling with a fair amount of joint pain, had plantar fasciitis, which she'd been struggling with also for a couple of years. On top of this, digestive problems, mostly some constipation, alternating constipation and diarrhea. A lot of times with these, I see digestive issues and joint pain go hand in hand a lot of times. These are things that people can struggle with for a very long time, feeling like they're never going to be resolved. Menopausal symptoms, I think women have this idea like at some point they might go away. But these are the type of problems, digestive problems, joint pain, weight gain, like people just feel like maybe this is how life is now. Also, I didn't put on here, she was struggling with a lot of fatigue. But ultimately, her goal was 30 pounds of weight loss. She was on Ozempic. Her doctor prescribed the 0.5 pen for her. Initially, she lost a little weight, just a few pounds, but then really tapered off. She was not told anything about diet or lifestyle, and she came to me just really frustrated, feeling like, man, if Ozempic's not working for me, if semaglutide's not working for me, then maybe nothing will. I feel like, things are broken in my body, and that life's just not going to get any better. I'm exhausted. We launched into this, and the way that we start is I always run functional labs, and so we're going to run into this first panel, and I'm going to walk you through from start to finish exactly what we did with Bobby. So right out the gates, you can see a testosterone panel, and most people here, most women are not going to get a testosterone panel run. I always run the MS version of the testosterone, which is more specific towards women. I always love to check a free testosterone level and the total testosterone level. Those are what are going to give me the most information here. Now, in Bobby's case, her ovaries are still producing testosterone. And you can see that she's at 23 here, and the range is from 2 to 45. Now, I would prefer to see this a little higher, but it's certainly not terrible. Where we do see a huge deficit is here in the free testosterone category. You see 1.3. That's certainly quite low. I'd love to see that around a 4 or north of 4. Most people make the mistake, doctors and patients, thinking that testosterone is only for men. Women don't need that much of it. It's not that big of a deal. Testosterone is your get up and go. It's your body's ability to recover. Testosterone goes into each individual cell. It enhances the cell's ability to recover. This is why bodybuilders take testosterone, so their muscles recover faster, but it happens in other tissues in the body as well. So when we're working to heal things like leaky gut, digestive problems, make sure that your hormones are adequate, help from the perimenopause perspective, When it comes to healing, this is very, very important. Also, there's been a lot of research done that having adequate testosterone levels helps with metabolism. The ability to trade fat for muscle really becomes improved when testosterone levels are optimal. So one of the first things we did with this patient was testosterone therapy, a very low dosage, 10 milligrams per milliliter, injecting 0.6 per week. And that was one of the things that ultimately really helped her quite a bit. So we started there. I want to mention that I think that Bobby could have still been successful had she not done testosterone therapy. There's some other herbal therapies out there that could have increased testosterone. This was just the most direct way to help influence her hormones that she decided to choose. Next here we see her cholesterol panel. I don't really look at total cholesterol much as a functional medicine doctor. I look more at triglycerides, LDL, and we want to see plenty of HDL. So the good cholesterol is the HDL, and she certainly has plenty of that. So that's not the problem. The problem here, we see triglycerides are quite high. I actually want to see them at 100 or below. So they're over double as high as we'd like to see them. And she was fasting for this sample, this test. And when I see triglycerides, I think carbs. Bobby was consuming too many carbs. And this starts to give you a little bit of a mental framework. When I see this above 200, I think, man, that might be about twice as many carbs as she should be eating. So I like to think of it in terms of a percentage here. And that was one of the ways that we also helped her from a dietary perspective, as we helped her reduce her carbohydrates and increase her protein levels. LDL, we look at it a little bit differently. This is a marker for me for dietary intolerance. Now, if you're in another medical profession, you might say, hey, that's total BS. This is just what I do, running labs with many, many, many people. When we remove dietary intolerances, we see LDL come down. Now, we're going to take it a step further from just LDL. I want to see this below 100, so it's about 30% high, 35% high here. Let's go ahead and scroll all the way to the bottom, so sorry on your eyes. And we did a particle. This is a lipoprotein fractionation, where it looks at the actual number of particles in that LDL. So it's a more precise number. It's breaking it down small, medium, large, and giving the actual particle number. The reason why we run this test is, most importantly, this LDL-P, or particle number. The more small LDL you have floating around, the worse off you are, because those small LDL have a higher chance of becoming plaque in your arteries. And we really don't want that. And I see this driven through diet. Above and beyond. Now, obviously, exercise can help a great deal. Bobby needed to be exercising a little bit more than she was. However, diet ended up playing the biggest factor in reducing this for Bobby. So ultimately here, this 1600, we really want to see this down around closer to 1100 to be in the optimal category. And for the small, closer, under 150, really under 140 here. Now, Bobby did have one really good thing going for her, and that is that this LDL pattern type was a type A, which means that there is less likelihood for oxidization, meaning that of this high particle count, she has less of a likelihood of developing plaque. Next, apolipoprotein B. This is just another independent risk factor for cardiovascular disease, like that LDL-P or that particle number. This is independent. It is also like a form of cholesterol that just shows you your overall cardiovascular risk, and it must be done fasting. Ultimately, we want to see it below a 90. It is also influenced by dietary sensitivity, and exercise. So those are all things that we wanted to work with with Bobby. So this was just a benchmark starting out. Now, her snapshot blood glucose was under 100, so it did not get flagged. Looked just fine. I will say that anything above 90 fasting starts to raise a little bit of a red flag for me. However, if we jump down to her 3-month average blood sugar, her hemoglobin A1C, you'll see 5.4. And this is a little higher than optimal. I like to see it from 5 to 5.2. Anytime you start to get a little higher than that, you're starting to cross the boundary towards type 2 diabetes or prediabetes. So we want to be careful with this. Now, I'm going to jump around just a little bit because we're talking about blood sugar right now. Her insulin levels were also a little elevated. We want to see these fasting below a 5, and she's at a 7. So that shows that she did have some mild insulin resistance, even on the semaglutide or Ozempic. Ozempic is geared towards helping you reduce the amount of insulin that you produce. Makes you produce or need less because it's making those receptors more sensitive. So hopefully that makes sense for you guys. So we want to get that insulin down. Again, that does come down to diet and exercise. And making sure that you're dosed appropriately with your Ozempic. Liver levels look good. We want to see this AST, ALT that's testing for the liver. That looks really good. Her kidney filtration looked great. So no issues there. GGT, this is another liver test. Make sure she's not drinking too much alcohol and trying to get away with. A lot of people will tell me, oh, I don't really drink that much. And then this level will be off the charts. And that's usually a sign that something's going on. Her thyroid looked excellent. And she had no antibodies there, so no Hashimoto's at play. SED rate, this is a marker for inflammation, head to toe inflammation, was also quite low. So I saw that was not playing a role in her joint pain. Iron levels look just fine. Her capacity was on the higher end, so she definitely could have absorbed or been taking a little bit more iron or getting a little more iron in the diet. Either that or it's just simply not getting absorbed. Typically, we do not absorb or retain iron very well when we have digestive impairment. We knew that Bobby had digestive problems, so this was an area of focus. Now check this out. Her ferritin, iron storage, is at a 50. For a woman her age, we want to see that closer to 90. So that is something that we want to see increase. I did not put her on an iron supplement. We just simply worked on her digestion and removing inflammatory foods from her diet. B12 was okay, 660. We want to see that above 500 on all people. She did not have rheumatoid arthritis, CRP. This is some vascular inflammation. We always want to see this below 1 in all people. That is an area of focus. We did want to see this come down. FSH, LH, these are what we check to see how far along in the menopause process that a person is. At 6.2 FSH, it shows that she's not in menopause at all. So she's relatively early on in perimenopause from a laboratory standpoint. Progesterone was extremely low, so bottomed out at 0.5. That is the lab 0 for reference. And estradiol, which is estrogen, the form of estrogen we like to check, was at 127. So this is adequate. Her ovaries were still producing estrogen, but not progesterone, and this is the typical pattern. So here we have identified the reason for her hot flashes, her sleep disturbance, and some of these other vasomotor symptoms that she's experiencing. So we want to address that. I did end up prescribing progesterone 200 milligrams per night for her, which worked very well to get rid of the symptoms that we were discussing. Candida. This is a digestive yeast that we find in a lot of people with digestive impairment. A lot of times when blood sugar is too high, Candida goes up. It's a yeast that grows in it's a normal part of our digestive tract that can get out of balance. And so this is something else that we check for. We don't necessarily treat it, but we make sure we're treating the gut. And in doing so, a lot of times this will normalize. Vitamin D is extremely low. So we definitely have to put her on a vitamin D supplement. And ANA, I just look for further autoimmune disease, which was negative for her. So very, very, very positive thing here. We do not want to see positive ANA. That's the body turning on itself. So let's go ahead and review a treatment plan. We already talked about LDLP. Let's review her treatment plan. If this information is exciting for you, then check out our semaglutide secrets course. We're actually doing the pre-sale on it. It's coming to an end, so you can still get it for under $100. But basically, it's going to help show you exactly what to eat, how much to eat. It's going to tell you all the ins and outs of Ozempic and semaglutide GLP-1 therapies to take you from knowing nothing to knowing, literally trying to show you as much as I know. So I want to download that information to you. But before you guys go, let me show the treatment plan of exactly how we helped Bobby, exactly the treatments that we used, using this lab work and applying it to her to help her lose that 30 pounds and feel so much better. So here we have Bobby's treatment plan. And I just want to go through this and show how we were able to get her to lose that 30 pounds. And that was in a 4-month time frame after starting this regimen. So initially we had her split that dosage of semaglutide in half. So she was doing 0.25 milligrams twice per week instead of 0.5 milligrams once per week. That was helpful for her. We also switched her from Ozempic to a compounded version of the product, which was awesome. And she felt like initially she actually just doing that alone got some bang for her buck and got more out of her GLP-1 product. We did a intense supplement program for her. I do this for every single patient that I work with. We customize the supplements. So these are the base supplements that she was on that are relevant to the labs that we discussed. So she was on probiotics. She was on a digestive repair formula for her small intestine to help absorb those nutrients better. She was on anti-inflammatories. This would have been curcumin, high potency curcumin product, vitamin D, and DHEA. One of the things we didn't discuss in that lab is her DHEA levels were relatively low, and I believe they were around an 80. And so we wanted to pump those up 150 or above for her, which brings us to our hormone therapy regimen that we prescribed for Bobby. The progesterone, 200 milligrams orally per night, and her testosterone in the form of that is cypionate, 0.6 milliliters once per week, and that's 10 milligrams per milliliter. I use this dosage and concentration typically is a good starting dosage for women. And she, just with these two things, right out the gates, hormonally felt so much better, so much more drive, get up and go, energy, as well as filling in with these products here. Her plantar fasciitis completely went away, completely resolved. I attribute that to getting the hormones under control because a lot of times there is an anti-inflammatory component to having your hormones regulated, as well as the curcumin product. And also on top of that, just getting your digestion in order, because all those digestive problems are going to be where the inflammation typically originates. And so we really have to double down here, especially for weight loss. If your digestion is out of whack, then you're not going to lose weight. That's the rule of thumb. Digestively, we did a whole foods diet, high protein, lower carb. Note I'm saying low carb, not no carb here. Her carbs were around 100 and her protein was around 100 grams. Not too low on the carb front, but remember what I said in the beginning. This was actually, she was eating north of 200, around 250 to 300 grams of carbs per day prior, and so we cut that back, and that came with the stopping the processed foods, and that helped a lot. Now, hitting 100 grams of protein is quite a task if you're not used to doing that, and so we did supplement with hydrolyzed beef protein powder in the morning and sometimes as a meal replacement when she was on the go. One of the things you might hear me talk about on this channel is when it comes to weight loss and reducing the body from inflammation, I really am strict with my clients initially on nightshade vegetables, dairy, and legumes, and we did pull those from her diet. She instantly saw weight come off when applying that. So that was it, and we did this for 4 months, and as we ran labs, things got better. Hormones got balanced out, inflammation came down, and those cholesterol markers dropped significantly, many of them into the green. So she was healthier overall. She had none of her menopausal symptoms, tons of energy, digestion got better, and was out of pain, and 30 pounds lighter after that 4-month period. So pretty cool. If you guys like this content, then please go ahead and give us that thumbs up, smash that like button, and go ahead and subscribe to us and hit the alert so you're notified when our videos come out weekly. I'm so happy that you're here. Thank you so much, and I will see you guys next week. Take care. Bye.